Let's talk about the actual benefit of diet versus drugs. I saw an interesting article by Dr. Michael Greger. He said one of the significant reasons people may undervalue diet and lifestyle changes is due to an overwhelming confidence in the effectiveness of medications and procedures for disease prevention. He pointed out that many individuals trust medications and screenings more than lifestyle changes. For instance, people often overestimate the effectiveness of screenings like mammograms and colonoscopies in preventing deaths from breast and bowel cancer. They also overrate the impact of medications such as Fosamax for hip fracture prevention and cholesterol-lowering drugs for fatal heart attack prevention. Now, patients commonly believe that statin drugs like Lipitor are dramatically more effective than they actually are in reducing heart attack risk. Dr. Greger notes patients frequently misunderstand the effectiveness of drugs. Many wouldn't choose to take multiple blood pressure medications if they understood the realities, creating a dilemma for doctors. You see, most patients desire transparency. They want to know the realistic chances of benefiting from a drug. However, as Dr. Greger highlights, there is a conflict between their right to know and the likely decrease in willingness to adhere to the medications if they were fully informed. If taking a cholesterol-lowering drug genuinely reduced your heart attack risk by 100% over the next 5 years, Dr. Greger states, most individuals would jump at the chance. Now, conversely, if the actual benefit is only a few percentage points, in the interest of long-term adherence, it drops significantly. For many people, the typical chance of benefit from cholesterol-lowering or blood pressure medications is actually less than 5% over 5 years. Now, it's not surprising that doctors rarely share these statistics, as even high-risk patients show less than a 5% likelihood of benefiting. Patients typically prefer drug treatments with at least a 20% chance of effectiveness, Dr. Greger emphasizes, illustrating the need for better communication between doctors and patients. Now, a study indicates that if patients were informed of actual percentage of benefit from preventative drugs, there would be a notable drop in the willingness to use them. Yes. So recognizing this, Dr. Greger explains doctors and pharmaceutical companies tend to exaggerate the benefits, often neglecting to mention how minimal those benefits can be. And this lack of transparency may lead to practicing deceptive medicine. Now, the best cholesterol-lowering statin drugs can demonstrate an absolute risk reduction of only 3.1% over a 6-year period, according to Dr. Greger. And he remarks, in contrast, adopting a whole food plant-based diet could yield an absolute risk reduction of 60% within just 4 years. Remarkably, Dr. Greger adds 99.4% of individuals who adhere to this diet avoided major cardiac events such as death from heart attacks. We must consider our options. It's not simply a matter of choosing diet versus drugs, because as Dr. Greger states, in 97% of cases, medications may not deliver any real benefits. We are sometimes left facing the risk of side effects without genuine efficacy. While focusing on dietary changes can directly address the root causes of diseases and even reverse its progression. So by transitioning away from artery clogging diet, our bodies can start to naturally dissolve the plaque. Dr. Greger asserts this can often happen without the need for drugs or surgery. This isn't based on complicated regimes. Dr. Greger explains that the Ornish study didn't even require exercise, meditation, or stress management, just the introduction of a healthy, whole plant food-based diet. So this approach could potentially outperform medications by 20-fold in combating our leading cause of death. Now, it's a vital message that doctors should consider sharing with their patients. Indeed.